So, good evening, dear friends. Meeting after a break of a day. And first of all, very happy Navratra Mahotsav to all of you. So it has started a new day for all of us also. Everyone have got the message that we are starting the Divine School of Homeopathy today. And it's a big occasion for us today. We are too busy today in all those activities which will going to be conducted since today, and that's why it was a busy day for us along with the OPD, regular OPD. So we are discussing regarding the 6th edition of Organon of Medicine, and we are in the introduction written by James Krauss to the 6th edition. We are on the concluding part of the James Krauss introduction. This whole introduction revolves around the scientificity of the homeopathy. While explaining the scientificity, he explains over there the importance one must know as a homeopath. One must know how scientific pathy he is using in his practice. Generally, what happens, being an homeopath, we never know the scientificity of it. And that's why he tried to explain all those points in detail. He explains what is exactly meant by the science and how this science is applied in homeopathy. The correlation between the scientific logic and with the homeopathy. That aspect he tried to explain over there by explaining many things about the science. The human logic always thinks with the induction and deduction, and this is what explained by Lord Bacon. And then he explains that every induction should follow the 4 criteria: the exact observation, the correct interpretation, the scientific construction, and rational explanation. And throughout his life, Dr. Samuel Hahnemann followed the Lord Bacon. He followed these 4 points through and through. Right from the day one, that is in 1790, till his death, he was doing and following the Lord Bacon in regarding the inductive reasoning, and explained the importance of homeopathy in such a manner. So we are at the end of this introduction written by James Krauss. So last paragraph we have to finish, and then we have to go to the further aspect of the book. So we'll start with the last paragraph. Before that, there was last sentence, which was very important of the earlier paragraph, that Pasteur, like the elder and greater Hahnemann, was the scientific experimenter, not a would-be experimenter. And this is what Hahnemann is. Hahnemann was the experimenter who was scientific experimenter. Before doing any experiment, there was a thought in Hahnemann's mind. There was a hypothesis in Hahnemann's mind, what to do, for what purpose he is going to do that experiment, what are different reasons. And then he used to experiment, and he was used to find it out, the inference of experiment. And if it is found really a truth, then he used to include it in organ. And this is how the whole organism is made up of. So to conclude this chapter, to conclude this introduction, what James Krauss says is, the era of scientific medical experimentation begins with Hahnemann and nobody else. Scientific to the core, Hahnemann experimented scientifically for scientific observation. Yes, it starts with the science, because whatever he was translating, because of his exact observation, it was possible for him to go ahead. He was he has made the experiment Syncona experiment because he was not just translating, because most important thing was that he was ready for understanding what he was translating, and because of which he has done the Syncona experiment. Alert with the intellectual power, he conceived his induction scientifically from scientific observation. Uncompromisingly scientific for experimental verification, He verified his induction scientifically for all time on his patients and made his method of symptom similarity for all the time the central curative method of scientific and medical therapy. So it is not on day one he has made the things. It is in 1790 he first experimented with cinchona. Then he labeled that there might be a possibility that there must be a law which is correlating the patient's complaints with the medicinal complaint. That thought, that induction was there in his mind at that time. But this induction, he never explained to the world on day one. This induction remained in his mind unless and until he classified all the four criteria of inductive logic. Please keep your mics off. So ultimately, for 6 years he experimented with his thought. The induction was there. There must be correlation. There must be such a law of symptom similarity. That might be a possible. But he never explained it to the world unless it is scientifically proved. And that's why he followed all four criteria. He has done the correct interpretation followed by scientific construction. And he used to do it again and again, again and again, again and again. And then when he was confirmed, you are ready for rational explanation in 1796, and he declared his patent to the world. He verified his induction scientifically for all time on his patients and made his method of symptom similarity for all the time the central curative method of scientific medical therapy. For over 100 years, this method has been consciously and unconsciously followed by the medical profession. So since then, everyone was following this method. Many times it was followed by consciously, sometimes it might be followed by unconsciously because people were not knowing what they are using, but they were using. And because of which this happened many times that they get the result, they don't know how they get the result. The results substantiate Hahnemann's contention. There is no greater achievement than to have a scientific truth, pass it on, have succeeding generations follow it, and express it. What James Krauss is saying? There is no greater achievement than to have a scientific truth. This is the scientific truth which is given by Hahnemann. And this scientific truth is very, very important. In fact, this scientific truth should be followed by everyone. Everyone should understand what Hahnemann wants to tell, and everyone should go ahead with that. That is more important. This is what he wants to explain. So there is no greater achievement than to have scientific truth, pass it on, pass it to the next generation. Have succeeding generation follow it and express it. Since last 30 years, I was working with this. I left my hospital and I started homeopathic clinic. So I refused to do allopathic treatment. I have started with homeopathy. And when I found that this is the truth, I've continuously worked over it again and again. And still I am doing that. I'm learning the homeopathy. At the same time, I'm trying to pass it on to you. It is your duty to pass it again for the next generation. Then and then our homeopathy, the dynamic scientific science, will survive. And this is what James Krauss is saying. You have to pass it on. Hahnemann's Organon of Medicine goes out to teach symptom similarity as the experimental basis of pathologic and therapeutic diagnosis as the H.A. Helwig of the scientific medicine. Underline H.A. Helwig. H.A. Helwig means authentic, genuine work. Authentic, genuine work. So what he is saying? It is the really a genuine work in the field of scientific medicine because he was very thorough with his thoughts. He used to apply the law of similars on the basis of two important things. One side there is a patient's presentation, or there on one side there is a disease manifestations, and another side there are medicinal manifestations, and you have to apply the law of similars. No place for thoughts, no place for speculation, no place for conjecture. Only thing is that what just find it out, what is the totality, find it out, and antitype totality from the medicine and just apply the law of similars. A scientific experimentation. And this is the big scientific thought which was started and begin with the Hahnemann. Till that period, no one was doing any scientific experimentation in the field of medicine like that. And that's why James Krauss says in this last paragraph, the era of scientific medicine starts with the Hahnemann, and this is really a truth. So we have read the James Krauss introduction. He has written it on 30th September 1921 at the Boston. And this is the best ever introduction I have ever read in my life, and which explains the details about the aphorism in a short way. So my suggestion, those who have not yet attended this, go through that. If you have any query, just go through the lectures. Those will be there in the YouTube. Hereafter, he starts with author's preface to the 6th edition. Author's preface means Dr. Samuel Hahnemann's preface. What he has read, what he feels, and what he wants to explain. So that is also we have to read, and then we have to turn towards the aphorisms, because this is the method with which one should approach when learning any book or reading any book. One should not miss in between things, because actually what Hahnemann wants to tell you in this 6th edition, that thought is explained by Hahnemann. Before going into what has written by Hahnemann, instead of that, what he wants to tell you before writing this book, that is more important for us. And that's why author's preface to the 6th edition, one should go. And there is a star. Author's preface to the 6th edition, and there is a star over there. So there is a footnote first, and then he starts writing it down. So we'll read that footnote in the star, what Hahnemann wants to explain, or what is written over there. In the Hahnemann's manuscript, he has a note in French which is translated as follows. Hahnemann ne je लिहिलं, whatever Hahnemann have written in his German edition, there was a footnote added to it. That was in French, but it is a translation what is written over there. Medicine as commonly practiced allopathy knows no treatment except to draw from the diseases the injurious materials which are assumed to be their cause. The blood of the patient is made to flow mercilessly by bleedings, leeches, cuppings, sacrifications, to diminish an assumed plethora which never exists as in well women a few days before their menses. An accumulation of blood, the loss of which is of no appreciable consequences, while the loss of blood with merely assumed plethora destroys the life. So that was the thought, that was the problem with the people who used to practice before Hahnemann. During Hahnemannian era, there were many practitioners who used to do such types of practice. They used to tell the patient that there is increased amount of blood in your body because of which you are suffering. So nature tries to throw it away through the menstruation, and then you feel better. So it means you must deduct something from it, and they have deducted some wrong logic. They explained to the people it is necessary to remove the blood from your body, either by applying leeches, by taking the cuts on the body, by bloodlettings, by cuppings. Cuppings means applying again a big bottle directly to the blood, to the body, and removing the blood. There was one person, Brasu, who was leader at that time, and he has developed what is labeled by the name of physiological system of medicine. And what this Brasu was doing, he was just taking out the blood of the people, patients who were suffering from many elements. And he used to tell the people, your quantity of blood in your body is increased because of which you are suffering. Let us remove the blood. And this was his consideration. So Hahnemann, to start with this edition, he explains in the footnote such types of bad methods were prevalent during his time. Medicine, as commonly practiced, seeks to evacuate the contents of the stomach and sweep the intestines clear of the materials assumed to originate disease. There was one more thought which was there with the people's mind, and that thought was the disease is caused because something is entered inside the body. Still, allopathy deals with this thought. Something entered in your body which is responsible to produce the disease. So if this thought, if this logic is used, the answer is very simple: to remove that by any means. So everyone was coming out with some methods. Someone used to give a method that they should use the purgatives. Another comes, they should induce the vomiting. They used to give the emetics. Some used to give the medicines which produces more and more sweating, diaphoresis. Some used to give diuresis. And all those logical considerations were there in people's mind during that time. And this was the problem during Hahnemann's era. And that time Hahnemann came out, this is something wrong. He was the in fact MD from the allopathy, and still he denied all those things which were rampant during his time. And that's why he stopped doing the allopathic practice, because he was not satisfied. There was no logic in all those things. And then he starts writing the introduction, preface. What he says: in order to give a general notion of the treatment of diseases pursued by the old school of medicine, allopathy, it may be observed that it presupposes the existence of something excess of blood, which is called to be a plethora, which is never present. Sometimes of morbid matters and acridity. So there was few thoughts. Either disease is caused because there is increased in blood. Second was that either because some morbific matter or acridity enter inside the body, because of which the disease is there. So such thoughts were there. Hence, if this thought is present, hence it taps off the life's blood and exerts himself either to clear away the imaginary disease matter or to conduct it elsewhere by emetics, purgatives, silogogues. Silogogues means which increases the salivation. Silogogues. Silogogues is the thing which increases the flow of saliva. Diphoretics. Diaphoresis means which increases the sweating. Is diaphoresis. Diuretics, increasing the more and more urine formation. Drawing plasters, there was that method was very popular at that time. They used to apply the plasters, hot plasters over that blast. Then setons and issues. Setons and issue is nothing but the applying the thread at different points and producing a discharge through it. That is those methods were setons, applying the setons and issues. In the vein, believe that disease will thereby be weakened and materially eradicated. There was a thought by doing such methods, the disease will come down, its strength will decrease, and patient will be settled. But what used to happen? In place of which the patient's sufferings are thereby increased, and by such and other painful appliances, the forces and nutritious juices indispensable to the curative processes are abstracted from the organism. So because of this method, either by producing vomiting, either by producing evacuation, either by producing the giving purgatives and producing more stools and diaphoresis, what used to happen? The only thing used to happen was the vital juices used to become less. And if vital juice is becoming less inside the body, the person becomes more and more deranged, more and more disturbed, and ultimately leading towards the destruction and death. And this was not, with this, Hahnemann was not happy. He was not happy with all those methods, and that's why he stopped doing the practice. What he says, it assails the body. Assails manje halla karne. It assails the body with large doses of powerful medicine, often repeated in rapid succession for long time, whose long enduring, not infrequently frightful effects it knows not, and which it purposefully, it would almost seem, makes unrecognizable by commingling of several such unknown substances in one prescription, and by their long continued employment, it develops in body new and often ineradicable medicinal diseases. So after doing this, all those methods, there was one more method which was very popular and which is still popular by giving many medicines and giving those medicines in material form, large doses. And all those medicines, when used in large doses, used to produce their primary effects on the body. Nowadays, it is a method that if you see the prescription of modern medicine, it starts with the on one end, and it from the last on the back side it finishes. There are many medicines where they used to prescribe, and all those medicines have their primary effects on the body, causing more and more damage. This is truth. Nowadays, in your practice, what is more common is the maximum effects happen because of steroids, maximum effects happen because of remdesivir, maximum effects caused because of many unknown medicines used during the COVID-19. I'm getting, just now I have treated, today I got the 373 number case of avian. And it is increasing day by day. The data of avian cases is increasing. Why this avian is happening? It is only because of the hazardous effects caused because of such medicines. And this was there since Hahnemann. And they used to use it in a very big doses. When I used to see when I used to see more and more cases, I used to find it out over there. Many a times, the medicines which are used, generally the steroids, the antihistaminics, the anti-allergics, the antibiotics, strong antibiotics, as well as local antibiotics, local steroids, all those things, prescriptions, we used to find it out. And what they causes? They causes nothing but the damage to the human health. And this is so common. So you have to look for this. This is not from not only during Hahnemannian time. Now also this is the thing which is happening. Whenever it can, it employs, in order to keep in favor with its patient, remedies that immediately suppress and hide the morbid symptoms by opposition, contraria contraris, for a short time, that is palliatives, but that leave a cause for these symptoms, the disease itself, strengthened and aggravated. Many times they used to use the palliatives, antipathic measures. So you will going to see that in totality of the symptoms, they chooses one of the symptoms, and for that, if they have antipathic measures, they used to give. So if the patient is having 10 symptoms, out of which one symptom is constipation, they used to prescribe the laxatives immediately. And after taking laxatives, patient feels better for a day or two because it is a direct effect, that is the primary action of laxative happens on the body. And when such laxative effect is there, patient temporarily feels better, but inner disease goes on increasing. And when the action of that laxative disappears, the original disease comes out with increased strength. And this is same thing which you used to find it out in day-to-day practice. You see the patients who are suffering from the asthma, they used to take those inhalers. They have the habit of getting the inhalers. And they used to take a puff, they feels better for time being. And after some time, whenever the effect disappears, they again get the severe asthmatic attack. Again, they used to do the same thing. This is quite common. This used to happen. Hahnemann explains all those things, that those were the practices were present during his time. It considers affections on the exterior of the body as purely local and existing there independently. And Venli means nirarthakpane. Venli supposes that it has cured them when it has driven them away by means of external remedies, so that the internal affection is thereby compelled to break out on a nobler and more important part. And this is the common practice which is done in allopathy. You go to skin specialist OPD, sit over him only for one day, and just observe what he used to prescribe. During Hahnemannian time, there were less local medicines. Now there are ample local potent steroids. One 5 gram ointment costs 300, 400 rupees. It is only 5 grams. But it is so potent that once you apply it on eczema, eczema disappears within a day or two. Patient feels, yes, he is very good with this, with such a medicine. He doesn't understand. It is only just a removal of the symptom by local means, and it entered somewhere else inside. It goes, it transfers from the less important organ to a more important organ. This is how it happens. This is what is the suppression which happens. And this aspect he wants to explain. This is what going on during Hahnemannian time. The suppression was going on. And that suppression used to produce many disorders. In fact, when Hahnemann have reached to the causes of chronic diseases, what he has said, there were 7/8 cases of psoric miasm and only 1/8 cases of syphilitic and psychotic miasm. So it was, that suppression was so marked at that time. And now what is there? There are 7/8 cases of mixed miasms and only 1/8 cases of psoric miasm in recently. So what is happening? This is becoming more and more difficult to cure because of all those things. You will find many cases with autoimmune disorders, and they used to take, they are dependent on steroids, and when they comes to you, it is a condition where it is incurable. It remains incurable at that time. Many times you get very difficult cases for treatment because the disease has become from curable to incurable. And this you used to find when you start treating with the homeopathy. You get the pathological cases, and all pathologies are results because of all the suppression. So many times patient used to take very difficult cases, and you used to find it out. There was a lot of suppression since last 10 years, 15 years, 20 years. And then that patient is in front of you. How can it be very easy for treating it immediately? Today, I have taken a follow-up. She is the case of a chronic urticaria along with chronic allergic bronchitis, and continuously she was on that that spray was she used to take as a bronchodilator. At the same time, she used to take cetirizine, and if that urticaria never settles with the steroids, she used to never settles with the cetirizine, then she used to use the steroids. And when she came, her weight was 62 kg, and there was whole body edema all over the body. She was just 32, 33 years. So I asked her, it is better to will start reducing your medicines, and I have started with homeopathic medicines. I have started her on the Dalkamara, most probably it was Dalkamara, and after starting the Dalkamara, gradually first 2-3 days there was a lot of aggravation because I stopped giving the steroids and asked not to take the cetirizine. So urticaria was increased for time being for 2-3 days. She came to me for 2-3 days again and again. I asked her to keep the patient, and after 4th day onwards, urticaria stopped coming. The severity came down. Second important thing, her bronchial irritation started coming down, and all those things developed, and she gradually settled. Today, nearly about 2 months have been passed. Since 2 months, she has not consumed any bronchodilator, she has not taken any anti-allergic, she has not taken steroids, and now her weight today, I have measured it, is for 54.5. Whole edema all over the body disappeared. And what, because of those medicines, that edema was there. The fluid accumulation was there because of that, those medicines which were used. And this is the reason why the people are suffering. Such type of damage happens because of those strong heroic medicines. And Hahnemann's era was full of that. And this is what Hahnemann wants to explain. I think we'll keep that remaining part of the preface as it is. Tomorrow we'll continue with it because it is a big one which we have to finish. Tomorrow's session we might finish because 5 minutes are there with us. I want to discuss few things with all of you. Thank you, Dr. Chandrakant. You have joined today's session. Dr. Chandrakant Bhavkar, he is practicing at Mumbai and doing very good, having good practice. Dr. Ajit Kasar is today with us. Welcome, Ajit. Welcome, Chandrakant. Dr. Preeti Pawar, Preeti Sari, she is there. Again, welcome to Preeti. So it's a very good thing. I'm very happy you are here in this discussion. But I want to tell all of you that today, on the occasion of this Navratri, we are starting our the Divine School of Homeopathy, and we are starting all the activities with myself and my whole team, which is there at present with us. I have sent the message on the WhatsApp. Many of you have joined our Divine School by applying the membership, the Google form, and 500 rupees for permanent life membership. So you become a member of our Divine School of Homeopathy. I want to tell you few important things. From the Divine School of Homeopathy, you will get few important things. You will learn what is happening in day-to-day practice in my OPD. Those things will be shared with a practical way with all of you by my team members. So they will going to share what I have taught to them, then what we have discussed, what was the case and what was the differentiation, how I reached to such and such prescription, or if any clinical entity I have seen and I have taught them, that will be conveyed to you. So it is a big connecting link between myself and you through this team. That is the first thing. Second important thing, once you get joined with this, second important thing, that you'll get many activities will going to start in recent future. You'll get direct access many times if it is free, and if it is paid, then those who are the members will get nearly about the 10% concession every time. So those who are members of Divine School of Homeopathy. Third important thing, if you have any queries in your practice, that also you can share with our team members. We will try to find it out solution. If it is there from them, it's always better. If it is not there, they will take my help and it will be conveyed to you. Then it will be it is daily on the in the evening 9 to 9:30. That means 9 to 9:40. That time will be shared by all those members. Today I will going to introduce all of them to you, those who have joined our session. So it is a paid membership 500 for lifetime for everyone. But once you get member, you will get attached with us, and all the activities which happens in Sai Swami Medical Foundation, that will be conveyed to you, and you will learn a lot. This is for students, new practitioners, as well as for the practitioners. And there will be a treat every Thursday. So there will be a guest lecturer. Anyone from the seniors who used to practice will be there on every Thursday at 9 o'clock. We're going to share something. There might be a Dr. Chandrakant might get a chance, then Dr. Sidhu, Dr. Shishir, Dr. Gaurang, Dr. Sanjay Jadhav, all those my all colleagues, friends who are there, who have already joined our school. So my suggestion is there to Dr. Preeti and Dr. Chandrakant, please join our Divine School by paying the membership, so that you will become one of the member of Divine School of Homeopathy. We have to propagate the homeopathy, and we have to teach to each and every student whatever we know. I'm not saying I know each and everything, but whatever I know, that I must share. It is my duty, and this is what we have to learn. This is the way we have to learn. So at 9 o'clock, you will get the password on Telegram. There is a group on Telegram. So suggestion to all of you, get joined. Chandrakant, yes, want to say anything? Yes, you can join. Open your video and.
Sir, sir, we are life member of Divine School of Homeopathy.
You are already, but we want it in the form of Google form, and all the things, because so that it will be there. We have made created a big group on Telegram, and you will get joined over there, and you should be there on one of the Thursday. You might be there one of the Thursday. Ajit will be there. So those I expect from you, because you are the pioneers over here. So
Yes, yes,
those
definitely,
who
sir. I
have
will
not
join.
yet joined, they should join immediately. That is very important. And 9 o'clock, I will be there with all of you, those who have joined, and meet. So yes, sir, there is any